All right, welcome back to ABA exam review and the continuation of our BCBA mini mock series. Today we are covering H, selecting and implementing interventions. Based on our comments so far, H was by far the most requested area across all the comments. So we're going to focus at least one of our mini mocks on H as a whole. What we might do is go into individual task list items later, but here we're just going to go over an overview, 5 questions, all based around H. Now remember, if you have a request for a task list item or section, leave it in the comments below, and we will get to that in a future mini mock. Be sure to subscribe to get all of our video updates. Check out behavioranalyststudy.com for all of our study materials. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. Joe implements a DRA procedure targeting aggression. The replacement behavior is functional communication using mands and interverbals. After 2 weeks, data show aggression initially decreased, but is now increased in frequency and intensity beyond baseline levels, while appropriate requests occur inconsistently. What unwanted effect is most likely occurring, and what should be done? Now, a lot of questions from H go like this, right? We're trying to examine an intervention, what might be going right, what might be going wrong, and how can we fix it? And so this is really starting to act as a behavior analyst. In this case, we know Joe is implementing DRA, which includes what? What includes reinforcement and extinction. Now we have a replacement behavior, FCT. After 2 weeks, data shows aggression has decreased initially, but now is increasing in frequency and intensity. Why might that be? Well, if we're using extinction, what can we expect? We can expect some sort of extinction burst, a temporary increase in that behavior that's being put on extinction. Also, appropriate requests occur inconsistently. That's also not unusual for a new replacement behavior. Remember, with differential reinforcement, we're not only putting a behavior on extinction, but we're working to reinforce and build up a new behavior. So this is not uncommon at all with DRA. Now, with that said, what unwanted effect is most likely occurring, and what should we do? A, spontaneous recovery. Continue the procedure as planned. We have just begun this DRA, right? It's been going for 2 weeks, and spontaneous recovery happens after extinction has been successful. Obviously, we're not there yet. It can't be spontaneous recovery. Behavioral contrast. Modify the intervention to include reinforcement for aggression in some context. What do we know about the different context? Well, we don't know anything about the context at all. For all we know, Joe is in the same place doing the same thing over and over again. Not enough information to point towards behavioral contrast. Punishment effect. Immediately discontinue and return to baseline conditions. We're not using punishment, we're using DRA, which is extinction and reinforcement. Punishment is not involved here based on the information. So it leaves us with D, which is an extinction burst, which is what we predicted. Continue procedure as planned. Yes, with an extinction burst, 1, we expect them to happen. And 2, if we see them happening, that is typically a sign that extinction is actually effective. So given our options here, we continue the procedure as planned, monitor, and what we expect is that aggression to eventually, permanently, or at least for a time, decrease. Lacey completes a functional assessment for a 5-year-old client who engages in hand flapping that appears automatically reinforced. Research supports response interruption redirection blocking. The parents express strong interest in sensory integration despite limited evidence either way for SI. The family lives in a rural area with no occupational therapist nearby, and the parents both work full-time. What should Lacey do? We have rules around acting as the BCBA if you're friendly or friends with the family, working within our competencies, working with other professionals. And for the most part, if you live in a major city or a big area and there's options, then we can abide by those strictly. When are there exceptions? Well, in this case, if a family lives in a rural area with no OTs nearby, and the parents are both working full-time, options are kind of limited, right? And so as a good BCBA, what does Lacey need to do? She does this assessment, and she has research showing that this RIRD, basically response blocking, is going to be most effective. But the parents are really interested in sensory integration. Evidence doesn't go either way, right? So we've got evidence-based practice, and then another practice parents are interested in that we could take or leave. Given there's no OT nearby, given parents both work full-time, how can Lacey best manage the situation, collaborate with the parents, and get the best outcome for the client? A, implement RIRD since it has stronger empirical support regardless of parent preference. We can't just ignore parent preference, especially in a situation where there's not many other options. We have to at least take into account. Recommend RIRD and explore whether components of sensory-based interventions could be incorporated. Sure, as a BCBA, you're always learning. So your learning doesn't stop because you passed your exam. As research grows, you need to be familiar with these things. And even if we aren't experts in sensory integration, if sensory-based interventions are something these parents are interested in, you need, as a good BCBA, to figure out how can we incorporate it to their liking and can it be effective. C, refer for sensory integration therapy since parent preference is a critical factor in treatment selection. Well, the question says no OTs nearby, parents both work full-time. Referral is going to be difficult for everyone involved, right? We've got to work within the constraints of our environment. That's a key part of being effective. D, decline the case since there's a fundamental disagreement about treatment approach. Well, the truth is you're going to fundamentally disagree with the parents about a lot of things. If we can't decline every case where we disagree about treatment, it would never work. Now, 2 months in, if there's still a giant disagreement, nothing's getting done, different story, right? But this is a brand new start, just getting started. Lacey's got to try her best, do what's best for the client, recommend what she believes is right, and then see how can we also work in what the parents want as well. A behavior analyst trains 3 staff members to implement a token economy in a classroom targeting a decrease in the student leaving their chair. After 2 weeks, the analyst collects procedural integrity data during baseline showing staff A at 95%, staff B at 72%, staff C at 68%. Student baseline data show a downward trend. What database decision should the BCBA make? This is a good question, right? We're trying to make a database decision. What data points do we have? We have our procedural integrity data points here, and we have baseline data. What does baseline data show? A downward trend. Well, what are they trying to accomplish? A decrease in leaving chair. If our data are going in the direction we want the data to go during baseline, what do we typically want to do? We don't want to intervene because something is affecting the behavior in the way we want it to go, right? Even if it might not be us, the behavior is going down. There's no reason to intervene. However, staff is still struggling with integrity. So based on that, what decisions should be made? A, begin the intervention as planned. Well, if we're still in baseline and we see a decrease in aggression, which is our goal, why intervene at all? We're looking for steady states, or in this case, an increase before we begin. B, halt all data collection until the trainees improve their integrity. Don't need to do that, right? We have to retrain, but again, we're accomplishing our goal. C, remove staff B and C from data collection. No, that's your job as the BCBA to go in, and because they're going to be on other cases, so we can't just say, well, you're not doing well, we have to kick you off the case. You've got to go in and do what? You've got to reintroduce training. Just because we're effective and the behavior is moving in the direction we want, you know based on data that integrity is not good. What's your option here? We don't need to intervene, so go retrain the staff. One of your major roles as a BCBA is training and supervision and making sure your staff or whoever you're working with is as well trained as possible. You implement an FCT procedure for a client who engages in self-injury to access tangibles. After 4 weeks of implementation daily with high procedural integrity, data shows self-injury decreased from 20 per day to 18 per day, while functional communication increased from 0 to 2 per day. What does this data suggest? All right, so here's where we have to start drawing in other pieces of the task list. The thing where everyone gets hung up on is different pieces of the task list. There's X amount of questions on this portion of the task list. I'm better at this task list. What I always tell you guys and girls is to focus on fluency. Why? Because the task list is there as a guide, but the questions on the exam aren't laid out by task list. It's all combined. In this case, we're looking at intervention for an FCT who engages in self-injury for tangibles. We've gone a month. Self-injuries only decreased 20 to 18, and we've only gone to 2 instances per day. What is one of our dimensions? Well, we've got to be effective. Is, after a month, a very small decrease in the target behavior and a very small increase in the new replacement effective? I don't think so. So what does this data suggest? A, the intervention is not effective. Reevaluate. Sure, 4 weeks is long enough, especially daily, high procedural integrity. We're doing everything right. It's consistent. It's happening a lot. And we're just not being effective. And that's a problem. Read all your answer choices. B, the intervention is working as intended and continue the current procedure. A small decrease after 4 weeks, especially when it comes to something like self-injury, is just not effective enough. C, more time is needed before making any change. Wait another week. 4 weeks is long enough to make a decision, especially daily. That's a lot of sessions. You need to be careful about waiting too long to make an adjustment. The great thing about being a BCBA is you can make those adjustments on the fly. D, switch to a different intervention since DRO is clearly ineffective. Well, we didn't talk about DRO, so be careful with that. That's why we always want to read our questions thoroughly, because D doesn't even fit with the information we have been given. What we know is the intervention does not appear to be effective. We need to reevaluate. An analyst is working with a 4-year-old client in an inclusive preschool setting. The child's occupational therapist suggests incorporating sensory breaks into the behavior plan, while the speech therapist recommends using AAC during high frustration moments to reduce tantrums. The teacher is concerned about managing multiple strategies. What should the analyst do? Now, we do collaborate. You have to collaborate. We work as a team. And, of course, we have to respect everyone's role on the team. We're not the leader of the team. We're not making all the decisions. But if you're in a situation where you've got 3 other professionals, all with different ideas, it's in the school setting, so we've got to respect the teacher's needs as well. How can we, as the BCBA, try to remediate the situation? A, implement only the behavior plan as designed since they are qualified. What should the analysts do? Implement only the behavior plan as designed since they are qualified professional. They are the qualified professional in behavior reduction. While that may be true, all these other people are also qualified in working with the child. We can't just say, well, we're going to do our own thing. Do whatever you want to do. It doesn't matter. It does matter because our client's welfare is the number 1 priority. B, schedule a team meeting to discuss how each professional's recommendations can be integrated into a cohesive plan that is manageable for the teacher. This is absolutely the right answer. It's sometimes the hardest thing to do because people don't want to go to that length and they feel uncomfortable. But whenever you get in a situation where you're not comfortable, right? And I'm not talking about, outlandish situations, but just typical social situations. You got to remember, is this what's best for the client? And calling a meeting here would be. You have to do it, or try to at least. C, implement each professional's recommendation separately and compare which is most effective. We're not working individually. We're working as a team. We need to be on the same page. D, defer to the teacher's concerns and implement only what the teacher feels comfortable with. Now, obviously, the teacher's got to be comfortable with it, but we don't just defer to her for everything because it's her classroom. We're all there to help the child. We've got to make our best decisions based on the child's needs and not necessarily others. Your best, or the analyst's best approach here, try to get a meeting together, try to collaborate into a cohesive plan that's also manageable for the teacher. All right, thanks for watching. Check out behavioranalyststudy.com for all of our study materials. Subscribe. Leave a comment below for what you would like to see in the next mini mock. Like I said, H is very popular, so we can keep doing H. We can tackle other things. Let me know, and we will get to it. Other than that, work hard, study hard. I'll see you soon.